Welcome to Adult CPR, AED, and Choking. In this module, we are going to cover adult chest compressions, adult rescue breathing, adult AED use, adult team CPR, adult choking, and we will review. Adult chest compressions. Chest compressions on an adult require you to place both of your hands directly over the lower half of the victim's breastbone. You will need to lock your arms and push down 2 inches. You will then release all of the pressure off of the victim's chest. This should be performed 100 to 120 times per minute. Keep in mind, it is important to make sure you're not resting on the chest between compressions because that will prevent the heart from fully refilling with blood.
Hello, sir. Can you hear me?
Let's walk
Sir?
through the beginning of a
Can you hear
cardiac
me?
arrest. Recall back to our previous video how you will first check for responsiveness. In this case, the victim is unresponsive, so the rescuer starts chest compressions and then will eventually call for EMS. If this is as far as you get in a resuscitation, that's completely okay. By activating EMS, you're starting the first responders who can take over the rest of the process, and as long as you continue high-quality chest compressions until EMS arrives, you are circulating blood throughout the patient. This will greatly increase the patient's chance of survival. If able and willing, rescue breathing for an adult will allow you to replace depleted oxygen in the victim's blood. 3 options of rescue breathing exist: mouth to mouth and mouth to mask, which use the same technique, it's just that one has a mask and one is your mouth directly on the patient's mouth, and bag valve mask. With either technique, you'll want to provide 2 breaths, stopping once you notice chest rise for every 30 compressions. That's our compression to ventilation ratio. So again, for every 30 compressions, perform 2 rescue breaths. If you're unable to deliver breaths and you go over 30 compressions, that's completely okay, as long as you prioritize chest compressions over your other interventions. For adult mouth to mouth and adult mouth to mask, pinch the victim's nose closed, tilt their head back, place your mouth over their mouth forming a seal, or your mouth over the mask. Exhale 1 breath over 1 second into their mouth, watching for chest rise and stopping when you see the chest rise. Remove your mouth, allowing the victim to exhale over 1 second. Exhale 1 more breath into their mouth, watching for chest rise and stopping when you see the chest rise. Then resume compressions. If available and able, utilizing a bag valve mask or a BVM is the preferred method. Place the mask over the victim's nose and mouth with your thumb and index finger, using enough pressure to form a tight mask seal. Tilt the victim's head back while keeping a tight mask seal. Deliver 1 breath over 1 second, stopping when you note chest rise. Release the bag, allowing it to refill over a second, also allowing the victim to exhale. Then deliver 1 more breath over 1 second, again stopping when you note chest rise. AEDs are to be implemented immediately upon availability, during your chest compressions and rescue breaths. The person delivering the AED should be directed to work around the chest compressor to deploy the AED. So you are not delaying compressions, you are not pausing compressions while applying the AED. Some cardiac arrests are caused by disorganized electrical activity within the heart. In these specific cases, resetting the electrical system of the heart can restore organized and coordinated electrical activity, restoring the circulation of blood. The AED is able to determine these types of cardiac arrest and restart the heart by sending a large impulse of electricity through the heart, resetting it. To operate an AED, follow these 3 steps. Turn the AED on, place the pads on the victim, then follow the AED prompts. Make sure to avoid touching the patient while the AED is analyzing and during the shock delivery. For an adult patient, place 1 pad on the right upper chest as pictured, and place the other pad below the left armpit. Make sure to avoid placing the pads on breast tissue, over clothing, and over medical patches or bulges in the skin. Let's take a look at an AED being applied.
Adult patient. If the patient is a child, press pads firmly on skin. Do not touch the patient. Analyzing heart rhythm.
Here you saw the rescuer, as soon as they had an AED available, they turned it on, it started issuing commands, they've placed the pads appropriately on the patient as pictured, they're following the commands, they're clearing the patient. Once they deliver the shock, you see them resume chest compressions. If you have multiple rescuers, one person should establish themselves as a team coach. The role of the team coach is to ensure all important steps are being taken effectively and to promote effective communication. An effective team coach will identify and designate a person to activate 911 and ensure responders have access to the area. Identify and designate a person to perform chest compressions and switch them every 2 minutes. Provide encouragement and coaching to the chest compressor if and when necessary. Identify and designate a person to retrieve the closest AED and deploy it. Because again, you place the AED on the victim while chest compressions are happening. All of the steps of CPR need to be performed, and having a team with a team coach allows a resuscitation to happen quicker and with greater efficiency. In a little bit, we will circle back to performing adult CPR as part of our assessment. For now, let's continue on and talk about choking. Adults may choke for any number of reasons. It is important to quickly identify a choking adult and respond appropriately. A choking adult may or may not appear in distress, as the first few moments can be filled with confusion and panic. Pictured as an international sign of choking, which may or may not be present. You will need to determine if the victim has a complete airway obstruction or a partial airway obstruction. Is their airway completely blocked, preventing any airflow, or is it just partially blocked, allowing some airflow? For a victim with a complete airway obstruction, you will want to attempt to dislodge the object and relieve choking. Victims with partial obstructions that are able to move air and speak should be monitored until first responders arrive. Choking relief should only be attempted for complete airway obstructions, so let's review the two. A complete airway obstruction completely blocks a patient's airway and prevents them from moving any amount of air. They will not be able to speak, they will not be able to scream or call for help, they will not have any ability to breathe. In this case of a complete airway obstruction, attempt choking relief and call 911. In a partial airway obstruction, only some of the patient's airway is blocked, so they may have some ability to speak, they may have some ability to scream or screech or make some sort of noise. They may be able to move some amount of air. In this case, only call 911 and monitor the patient. You don't want to risk a partial obstruction becoming a complete obstruction. Adult choking relief may be performed with one of two methods: abdominal thrusts or chest thrusts. The most effective and ideal technique is abdominal thrusts, but requires you to be able to wrap your arms around the patient's abdomen. In cases where this is not possible and pregnancy, opt for the chest thrusts. And remember, if choking relief fails and the person becomes unresponsive, start CPR immediately. To properly perform abdominal thrusts, wrap both hands around the abdomen, just above the belly button. Form one hand into a fist with your thumb facing up and into their abdomen, and your second hand wrapped around your fist. Pull in firmly and brisk, repeatedly until the object becomes dislodged, or they go unresponsive and you start CPR. To perform chest thrusts is very similar to abdominal thrusts, except your arms are as high up under the person's armpits as possible. Chest thrusts should only be performed on pregnant people or people you are unable to effectively wrap your arms around their abdomen. To properly perform chest thrusts, wrap both hands around the chest under the armpits, and your hands over the lower half of their breastbone. Form one hand into a fist with your thumb facing into their chest, and your second hand wrapped around your fist. Pull in firmly and brisk, repeatedly until the object becomes dislodged. Pause the video here for a few moments to review. Go over your notes, go over the resources, including the student manual, to review the information that we've learned today. In a few moments, the video will continue. You'll get some hands-on practice utilizing adult CPR with our adult CPR assessment tool. Pictured is the Adult CPR assessment tool. These are all of the steps that every student must go through in order to complete the Adult CPR, AED, and choking relief module and become certified. You may perform this assessment as a solo rescuer, where you do all of the steps by yourself in order. Or, depending on the makeup of your class, you may work as a team and go through multiple assessments where each person is doing a different skill. Either way, you must perform all steps to be considered complete from the program. The first section is initial scene management. As you approach the patient, you need to check for breathing and responsiveness, but don't spend more than 10 seconds. Any time spent not performing CPR decreases the victim's chance of survival. Then, you need to call for help. You need to direct somebody to call 911 and get an AED. The instructor will inform you that the victim is not breathing, not responding, and does not have a pulse. It's at that point that you must immediately begin CPR. You should perform high quality CPR, which includes proper hand placement over the center of the chest, proper depth in an adult, that's 2 inches, allowing for full chest recoil so the heart may fully refill with blood, and a right rate and rhythm, 100 to 120 beats per minute for adult CPR. Then, provide rescue breathing, providing 2 rescue breaths after 30 chest compressions. You may use mouth to mouth, you may use mouth to mask, or you may use a bag valve mask. You may do any appliance as long as you're getting 2 complete breaths for 30 compressions. While you perform breaths, do not delay compressions for more than 10 seconds. Ensure you have adequate chest rise and you stop your breath on chest rise. After 30 compressions and 2 breaths, you resume high quality CPR. It's at this point an AED will become available. You must deploy the AED while continuous high quality CPR is being performed. If you are performing this solo, your instructor will do chest compressions for you. If you're performing as a team, another team member will be doing the compressions. So then you turn the AED on, you properly place the pads on the victim, you follow the prompts of the AED, and understand different AEDs and different trainers may have prompts a little different, so follow the prompts that you're provided with. You then must safely deliver a shock. That means you're not touching the patient, that means nobody else is touching the patient, and the pads were applied properly. Immediately after shock delivery, you resume high quality CPR upon AED direction. Upon completing all of those steps, I'd like to congratulate you on receiving your certificate of completion for adult CPR, AED, and choking relief.